Good morning and welcome everybody. This is Dr. Troy Adams and I'm the Chief Operations Officer of WellSteps. I would like to welcome you to our webinar today. I'd like to excuse my business partner, Stephen Aldana, who is crisscrossing the globe helping people with their wellness programs. But I'd like to issue a special welcome to the many attendees from our LinkedIn group, Wellness is a Business Strategy. That's a great group. We're about 17,000 strong, and we have fabulous discussions about pertinent wellness topics every single day. Very little marketing, so it's awesome. Welcome everybody. I have to be honest with you. Preparing these webinars for you are a lot of work. It reminds me a little bit of class preparation grind that I was in academia, but I love it. Because hopefully we're doing some good. And I'm really glad that you showed up. So this webinar, I have to tell you, was especially fun. I can't recall a time when I've had more fun preparing a webinar and I've been more excited to present it. Maybe except the time when I came down with laryngitis the night before and Steve had to present it for me. But seriously, I want to go on just a minor wellness industry public service announcement rant for a moment, because preparing this webinar has really helped me see how many of the awesome things that are happening out there in our industry. I have personally been doing this for a long time, since the 80s, and I can't recall a time when there's been such rapid growth or interest in what all of us do every day. I personally believe that this is due to what you might call a convergence of evidence that supports both the effectiveness, that means it works, and the cost effectiveness, means it's worth it, of wellness. To me personally, it has become clearer and clearer than ever that wellness, when it's done right, helps improve employee health. And it provides great value to the organizations who embrace it. There's no question about it. Oddly enough, the brighter this evidence becomes, it seems like the louder the voices of the critics get. And I just want to call this like it is for a minute. I think these critics are trying to capitalize on the surge of popularity in the wellness industry by provocation. You get more attention when you stand on a soapbox and beat your chest. Those of us who've been involved in the industry for as many years as I have, we see these attempts for what they are. But I digress. Let's not go there. Let's be happy and positive today. This is great news to celebrate. I'm totally pumped. Here's why. Today I have the great pleasure of giving out some awards. I should probably explain. So a lot of you are very familiar with the Emmys and with the Tonys and with the Grammys. And if you're a sports aficionado like me, you maybe have even heard of the ESPYs. For those of you who are not so sports oriented, those are given out every year by ESPN for sports achievements. So as I compiled all of these best worksite wellness tools, it became abundantly clear to me that there are no awards given by the wellness industry. Maybe there are, I just don't know about them. Anyway, we decided this was unfair, and by gosh, we wanted to do something about it. So based on other award shows, the Emmys, the Grammys, and Tonys, we concluded that our wellness awards should probably end with a Y, and they should have a really silly name that you could remember really easily. So let me introduce you to the inaugural Wellness Award Show this year, featuring wellness tools called the Wellies. And for some reason, I'm having a technical problem, but just trust me when I say that we're calling this award show the Wellies. I'm totally bound up here. And give me just a moment. Okay, there we go. The Wellies. Da, 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 da. So ends with a Y, right? The name is silly. Done. I think this is awesome. So let me just tell you where we plan on going a little bit today. We recently posted a video blog It includes 5 well-accepted guidelines for developing wellness programs. Some of you may have seen it. It's called 5 Steps to Building an Effective Wellness Program. Here are the 5 steps in case you haven't seen it. Know the business case for wellness. Prepare leaders and committees. Committees are the ones who do most of the work. Leaders provide a lot of support, and we get a lot further in wellness, especially in the worksite setting, when a leader and a committee are on board. Third, assess culture and employee health. Fourth, implement. That's probably where the most heavy lifting occurs, and then evaluate. How have we done? So the best 7 tools represent these 5 guidelines with multiple awards given in a couple of the categories. Don't worry, the number of tools we recognize is going to be 7, hence the name of the webinar. I should also point out, since some of you are just arriving in the webinar, that everything that we're discussing today is being recorded and will be posted later on our website. The slides for this webinar have also been posted at wellsteps.com. Just click on the webinars link in the lower right-hand corner of the page, or this information is in the webinars archive section. Also, fall phones have been muted. Most of you are familiar with the drill on webinars, but you can participate later by asking questions. There's a GoToWebinar control panel on the right side of your screen, and you can chat questions in as we go. I'm glad to have Ryan Isaacson riding shotgun with me, who's going to be helping us sort through the questions. He's going to be answering some of the questions that you have as we go along. I should also say, before we present any of the winners, because some WellSteps tools are winners, they're all free. Well, I received an awful lot of input. These are not just arbitrarily awarded. I got lots of great input. I want to thank Anthem, formerly known as WellPoint, Kaiser Permanente, WellCoa, David Honeycutt, among others. Members of the LinkedIn group Wellness is a Business Strategy, with a special thanks to group manager and friend Deborah Laffler for her excellent input. So with that said, let's go ahead and get started with the award ceremony today. So the award for making a business case, I should say that all of the award recipients have been listed on the page below. That'll appear on every slide from here on out, wellsteps.com/wellies. So you can go there and you can get links to all of these tools that I'm talking about, and I've not done so in the presentation. So the Wellie for the wellness tool that best helps make the business case is, it's the WellSteps ROI calculator. This was included on several lists and listed first by several different organizations and individuals. I looked, and about 110,000 people have used these ROI calculators. So that seems to indicate a strong vote with the feet. Now, with the mouse. The ROI calculators, I should say, were commissioned by Anthem, again, which was formerly called WellPoint, just up until recently. They asked Steve and I, WellSteps, to provide something simple that would help customers coming to their centers calculate or project our return on investment of wellness. They wanted it to be simple, but they wanted it to be evidence-based. That was quite a challenge. I'm glad to say it is both. So with just 3 pieces of required information, total healthcare costs over the past 12 months, total number of benefited employees, and the average percent change in healthcare costs over previous 5 years, you can use the ROI calculator, and it works really, really well. The user then gets estimates of cost savings for medical costs, absenteeism, and presenteeism. And there's 4 areas actually of projected cost: impact of reducing obesity, impact of reducing smoking, and impact of wellness programs. The algorithms do all of the work behind the scene. There's algorithms for healthcare costs, one for absenteeism, one for presenteeism. The algorithms are based on published evidence, and I'm happy to say they're updated every 2 years, have been since we released this ROI calculator, most recently at the beginning of this year. So the data that you're getting from the ROI calculator is very, very current. There are also, some of you have used this already, there are 3 optional pieces of information or data that will provide increased precision, but they're not required. So if you want more information about these calculators, I encourage you to click on the Science tab down there on the lower left-hand corner. It explains a little bit more about how the ROI calculator works. You can email me after this webinar, troy@wellsteps.com, or I'm happy to take questions at the end of the webinar to answer, to walk you through any of the things that you might be concerned about. I do see, just as a side note, I do see a great shift, not a great shift, but I do see a shift towards return on value. When we worked with Kaiser Permanente, they talked a lot about that. Is the investment a good value? They weren't so interested in the return as they were on, were they getting their money's worth? So hopefully that will continue to happen at any rate. The ROI, I should also mention the ROI calculators have been adopted by a major wellness entity, by a major health insurance carrier on the Western United States. And as I mentioned, 110,000 people have used it, one of the 3 calculators, and they are free. So that's great news. I will say personally, professionally, it's one of the few things that we've done right at WellSteps. I'm proud of these calculators. All right. So the runner-up in this category is the physical inactivity calculator. Many of you may not know about this. This calculator is based on the work of Dr. David Chenoweth, a good friend. This dude's a great researcher. And what he did was he created this tool, and it's really focused on physical inactivity. He averaged data from 7 statewide studies with about 76 million records. That's huge. He produced the estimated cost of physical inactivity on medical care, workers' comp, and lost productivity. In some of his description, he notes that data validity could impact the estimates, and he says that on the last revision, the data validity was ranked great or significant for medical care, and then kind of tapers off from there. There's not so much information about lost productivity, and we had that same challenge when we built and continue to refine the ROI calculator. That's your runner-up, the physical inactivity calculator. And again, for those of you just joining, the links to all of the awards can be found wellsteps.com/wellies. There's links to every one of these tools. Your special achievement awards, the cost of smoking calculator. That is a tool provided by America's Health Insurance Plans. The cost of unintentional injuries calculator, provided by the Business Group on Health, and the cost of alcohol abuse calculator by the George Washington University Medical Center. There are some other calculators out there too on obesity and whatnot. But we thought these 3 were particularly noteworthy. They're on special achievement list because it is unclear how recently they've been updated. All tools are on the Wellies page at WellSteps. And then finally, I didn't know what else to call it. Ms. Congeniality, if you've seen those movies. The CDC has a couple of great resources. One is called CDC Workplace Health Promotion, Reasons for Doing Health Promotion. One's called The Benefits of Health Promotion. Those are probably the most concise sources. They're not really tools per se. They don't do anything. They're just static web pages. But there's an awful lot of information, We call it government simple. Read the sarcasm there. Or Link City, awful lot of links to other places, but the basic information is fantastic. They're relevant, but they were just a little bit dated. That's why they're Miss Congeniality. So those are your awards for making the business case. There's a little surprise here on the next one. Preparing leaders and committees. The Wellie for preparing leaders and committees goes to nobody. It goes to nobody. Don't worry, we'll loop back. We'll make sure that there are seven tools provided. But here, I want to explain this a little bit. The Wellie for this category, it has to remain vacant this year. And this is not for lack of looking. I can promise you that. We looked and then looked some more. We finally concluded that there just is not a Wellie-worthy tool to help senior leaders, and this is one of the big takeaways for me in this webinar. Not a really good tool, one tool to help senior leaders get on board. And that is a tough nut to crack, getting senior leaders to be fully supportive. They'll give money, but to get them to participate and show visual support in what wellness is doing, that's a whole nother animal. It's challenging. Also, the tools out there to help committees understand and perform their duties. I mean, every organization that talks about how you do wellness really well, from WellCoa to WellSteps to who, I don't care who it is, they all talk about the importance of wellness committees. Everybody does, and the lack of tools out there, I thought, was one of the big surprises for me. Um, Now, I will say there are many PDFs and web pages. You can do a Google search right now and you can find all of those, but we were really looking for tools. And I acknowledge the difficulty in preparing a tool when there are such differences across company industries and company sizes. But so with that said, there are a number of people who recommended these tools. The runner-up is a wellness budget calculator. This calculator is based on rates from 9 national carriers. It's a runner-up, even though it was really only used 1,600 times. Maybe the news hasn't gotten out. But this thing is great because it helps overcome perhaps the number one barrier to getting a quality wellness program funded and implemented, and that's money. You know, if you've got a wellness program, you know that one of the challenges you have constantly is getting money for it. If you don't have a wellness program, you know that one of the challenges you have is getting money to fund it. A little bit like working with Congress. This tool is awesome because it helps you find money that is already tied up other places, primarily in the health insurance program. So this helps leaders, brokers, committees, whomever, helps them find money for wellness either by tweaking the plan design, and you'd be surprised. A lot of money can be freed up by making really small changes in the plan design with even with benefits that are not really perceived to be that great by employees. We're talking about $5 to $10 changes that can free money up. And also, it helps find money by using premium differential, which has become more and more popular. It's also very simple to use. So that's your runner-up. Special Achievement Award goes to the Wellness Compliance Checker. This one has been used about 3,700 times, and it is the Special Achievement Award because it was designed to help anyone. There was just a lot of fear out there about violating federal law. I have not personally seen any federal law police on privacy and discrimination, but nonetheless, we all want to comply with the law. So this one, it walks through the details of privacy and discrimination laws like HIPAA, ERISA, and GINA, and it puts all of it into a simple little question and answer tool. If you answer one way, you get the response, hey, you're doing it right. But if you're not, then you get a little bit of information on how you can change that and how you can become compliant with the law. So the Wellness Compliance Checker helps leaders and committees do wellness right. And then the Miscongeniality Award, I feel bad about giving WellSteps this award as well, but I want to say we've worked really hard. We recognize that there is a dearth of resources out there on training coordinators and committees. We're not that different than other folks out there doing wellness. We really need the coordinators and committees to do their job, and things work better when they do. So we've developed wellness training and resources that we think will help a lot. Help coordinators understand their role, help committees understand their role, to explain in video what coordinators need to do. A lot of things like that will really make this a lot easier, and that's all on a page that we call wellsteps.com/coordinators. Again, we put that link on the wellsteps.com Wellies page, so you can find that. So preparing leaders and committees. We'll come back to this as we progress. So we may end a little bit early today, which will give us plenty of time for questions. So the Welly there are 2 categories of assessment. One is workplace culture and one is employee health, because they're entirely different things. So I'm happy to say that the Welly, there might not be any surprises here, and this was sort of unanimous, I will say. The Welly for assessing workplace culture goes to WellCoa, the Well Workplace Checklist. I had a very nice conversation with David Honeycutt. I followed up on his advice to us in the last webinar, and that's call leaders. I called several different people. I had some great interviews. I talked to David, and basically he said, look, in the beginning of the wellness movement, right? Some of you can remember being there. The idea, the fundamental notion was that prevention is worth a pound of cure. We all preached that. And it was really easy to get people to believe that. People got it very, very quickly. But they wanted to know, how do you do it? How to do prevention. So this is the reason why, academic journals popped up, conferences popped up. They all were sort of targeted at helping people know how to do it. Once they knew how to do it, some of us are still learning how to do it. They needed a way to see year-over-year improvements, right? So, hence the wellness workplace checklist. So, providing how-to suggestions and progress updates that are both stated goals of the checklist, which is why it is your WELLY winner, is it does both. The best practices included in this checklist came originally from Dr. Honeycutt said about 170 published peer-reviewed research articles. And the WELCOA then turned these best practices into a 100-item checklist. The checklist yields a numerical score, and this is one of the reasons that it's the winner. It also, this is a really cool thing, it gives a 4-page executive summary. Executives won't read much more than 4 pages. And then for those of us who are involved at street level in the wellness industry, it provides 36 pages of planning-friendly recommendations. So it's in, this is a direct quote from David. He said, the best part is that it is FREE, free. He says, when you click submit, you immediately have an idea of what you're doing well and what you can do going forward. So the Well Workplace checklist wins the WELLY for helping to assess culture. And when I say culture, I mean environment and policy and a whole number of other things. And again, the link to this tool is listed at wellsteps.com/wellies. Dr. Honeycutt also wanted me to point out to this group today, he said in the second quarter of 2015, checklist version, he called it checklist version 2.0 will be released. He said it will, some of the enhancements of 2.0 is that it will include benchmarking scores against the 5,000 companies that have already completed the Well Workplace checklist. It will also allow sorting by industry, state, or region, and then by size of company, which are pretty cool features. He says it will still have around 100 questions, but it's not finished yet. He says it will still take about 15 minutes to complete. One of the really interesting nuggets I got from my interview with Dr. Honeycutt, he says, as wellness professionals, we all preach the value of physical activity. Most of the people on this webinar today are physically active. I'm physically active. I love it. And yet when one of the things that the tool does, checklist, it looks at priorities that companies sort of rank. And he says the priority they're ranked dead last, this is going to surprise you. The priority that companies ranked dead last was having employees get up and move every day. So we still have a long way to go in terms of helping companies come around and see the value in just not sitting. I'm glad to see a little bit of push. I noticed this on the topics that are submitted for discussion in Wellness as a Business Strategy. There's a lot more being done on helping employees stand up and while they work or walk around. There's a lot of value in that, and that's something that we can all do probably a little bit better. So the runner-up in this category is the Life Gain Culture Audit. This tool it's based on, 40 years of scientific evidence by Robert Allen, father of Judd Allen. Judd Allen now owns the company. They've done a fantastic job. Their tool is much more based on organizational psychology as opposed to things that you can change in the environment or policies that you can change. But it's really worth a look. It's based on cultural strengths relative to wellness barriers in an organization and kind of closing the gap. So it's a totally different approach, but it's a fantastic tool. This was mentioned by many of the people that we polled. Special Achievement Award goes to the Checklist of Change. This tool was also commissioned by Anthem, again, formerly known as WellPoint. And the goal of the checklist to change was to provide resources to help companies apply evidence-based cultural and environmental change practices, much like the Well Workplace checklist. It's just not quite as detailed and as intense. It's been used about 5,000 times, so it's getting a lot of play, and we're proud of it. So that's your Special Achievement Award. Your miscongeniality goes to the CDC Worksite Health Scorecard, which is based on a couple of other scorecards that I'm going to talk about later that are in other categories. But it's government simple, or you could say it's thorough like a tax return. So that's one of the downfalls of this tool. It's awesome. It's based on the best science, but it is a bear to get through. So, but it's there. So for those who really want a thorough look at how things are working, the CDC Worksite Health Scorecard, call me next year when you're done with it. It's a nice tool. Okay, so the next category is assess employee health. The Welly goes to the American Heart Association My Life Check. Now, a lot of you might be surprised by this, but I'm talking about programming resources for those of us who have limited resources and need something free, but need something that's really good. What I like about the American Heart Association My Life Check is that it's simple, and it's oriented on helping, not just raising awareness, which is an important value of a health risk appraisal, but is also oriented on helping people make changes in lifestyle. That's a failure of a lot of HRAs, or personal health assessments. If I did not have money for a health risk appraisal, I'm telling you, in my company, this is the tool I would use. It's super simple, it's super quick, and it's focused on major issues that help improve life and health. So the real age was going to be, the runner-up was going to be real age, which a lot of you have heard of. But the real age, we learned in this process, the real age assessment has been reoriented, I'll just leave it that way, to serve a purpose which, I don't know a better way to say this, we just couldn't universally support. Therefore, we vacated this category. We don't have a runner-up in this category. The Special Achievement Award goes to the University of Minnesota Well-Being Assessment. It's got a much longer name than that. I want to thank Deb Laffler, especially for pointing this one out. I did not know about this tool. What I liked about it was it is super simple. It's about 10 little questions you answer with the slider. It's focused on well-being, so it's subjective, but that's okay. It also comes with a goal-setting tool. I didn't think it was horribly simple, but it was nice that it came with a goal-setting tool to help set goals to improve well-being. So that's your Special Achievement winner. Now, going really low tech for your Miscongeniality Award. This is a CDC health assessment, which I think was actually developed in California as part of some grant funding that was done by the CDC. This is super low tech because it is a printable paper pencil health risk appraisal tool that's based on best evidence. It's a great low tech solution for some work sites, but you need to think through a couple of things. First of all, is how do users get feedback? It's got to be self-scoring. So I recommend that if you use this tool, you want to think about some public sessions where you answer questions, you provide some instruction, maybe some resources to help people address some of the issues that show up on their paper pencil health risk appraisal. And also just to point out, you'd think this would be obvious, but we work with folks that didn't really think this through. The aggregate report would be somewhere between difficult and impossible to get if you didn't have the data being archived someplace. Unless somebody sat down at a machine and put everything in an Excel spreadsheet, and then somebody actually knew how to crunch some numbers, you would have no aggregate information based on that. So these are your award winners for Assess Employee Health. And that takes us to the fourth category, Implement and Administer. There are two award categories here. One is for toolkits, and the winner is the Wisconsin Worksite Wellness Toolkit. Had a wonderful time chatting with the folks up there. This is easily probably the oldest tool out there, and it's been updated a couple of times. It was originally developed by 6 to 7 stakeholders that included healthcare, insurance, professionals, brokers, provider, people like that who sort of were dialed into wellness and health. And then they took the findings from that and they administered a survey to 600 people to develop the initial draft. And then, of course, it was refined, and then it was finally released in 2006. It's been updated in 2008, and then again toward the beginning of 2011. If you go to the website that we included on the wellsteps.com/wellies, you'll see that the cover says 2010. It should probably say 2011. It was right at the end of 2010 when they finished this revision. I will point out that this is kind of cool. 21 other states indicated in blue here use a version of the Wisconsin toolkit. They were clearly leaders in this area. They've modified it. They've changed the resources, maybe made it state specific. But basically, this toolkit has been the basis for many other toolkits and for training programs, which included over, I was told, 1,500 professional. There's no question, it is a leading edge piece for how to do wellness right. But I will say, if you try to use it read it like a novel, it's got about 133 pages. It will read a bit long because you really should use it like a dictionary. Find that if you've got questions about how to do one thing or another, you go to that section and you'll get lots of great information. Only minor criticism I have of this tool is that in places it's not the most visually appealing, but the information is rock solid, spot on, and it is your winner of the Welly today. Now, I'm sorry you don't have any special acts coming out and doing musical numbers. Maybe that's something we can do next year. And I personally want to nominate my business partner, Steve Aldana, to sing somewhere during the intermission. Maybe do a dance. We can broadcast that live. And since he's not in the webinar today, you can just consider all of you can consider him volunteered. So the next Welly goes to, or the runner-up for the administer and implement and administer toolkits is the WellSteps implementation guide. The WellSteps implementation guide, again, was commissioned by Anthem. It was dramatically influenced by the Wisconsin toolkit, which is why Wisconsin is your Welly winner. We needed it to be about a fourth the length or less of the Wisconsin toolkit, so it's only 25 or 26 pages. A little bit more of it is online. It's been downloaded about 5,500 times, and from our website, and who knows how many times from Anthem. It is substantially condensed, and I will say a little bit more visually appealing, but it's again, kudos to the Wisconsin folks. They've done a great job on their toolkit. Special achievement goes to the California Fit Business Kit. I've included a link to that. It's a lot of information on a web page, but it's a fantastic collection. And miscongeniality goes to the CDC toolkit. Same comment and criticism I have with other CDC resources, which is that they tend to be just a wee bit long. All right, your next Welly is for implement and administer for programming. This may be, the winner is the community guide. This may be the only Welly recipient that nobody has heard of. I hope you've heard of it. It's a fantastic resource. It's for sure the only government source that I think is simple and usable. It is a wonderful, wonderful resource. Here's a snap from the website. What I've done is I've marked task force findings. If you're, for programming purposes, you want to know that what you're doing is evidence-based. But you need to figure out what's evidence-based in the simplest possible way. So I would go to task force findings. That's the tool kit, or the programming source that I would use. It is a web page, but it's really the only way, if you think about it, to present the recommendations which are listed here. And if you want to plan evidence-based programs, man, this is a great place to start, the task force guidelines. There's going to be stuff there that might not be relevant, stuff for school-age kids and things like that, that won't be relevant for worksite wellness professionals, but it's a fantastic collection of evidence-based recommendations. Help keep you from making big mistakes when you plan programs. I love this resource. Okay, so I could not do an awards program without recognizing an app, because there's an app for that. That's a common saying. The runner-up in implement and administer programming needs is MyFitnessPal. And the reason why it's a runner-up is because it's sort of targeted just at individuals. It's a little more difficult. I know some folks have figured out a way to tie this into workplace programs. It's what's cool about it. If you don't have it, I doubt anyone on this webinar doesn't have it. But what it's done is blended the ease of using an app with social media. It currently has 65 million users, including me. Although I'll be honest and say I can't remember how to log in. I probably should. But it's a fantastic tool. This app, MyFitnessPal. Again, a lot of people are using it. Special achievement. This may surprise you. There's some great national health observance calendars out there, and I included these as special achievement winners because there's one from Health Finder that is very, very inclusive, and one from Wellco, which is more targeted on the best unique opportunities in by month. Either way, they're great for programs that are just starting up. That's why they're special achievement Welly winners. So let's say you're starting up, you're not sure where to begin. The great thing about some of the monthly health observances is you get a little bit of marketing help in the national media, maybe in social media. So it raises awareness a little bit among your workplace population as they go home and they watch TV and they see people talking about, hey, it's National Breast Cancer Awareness Month. Why not do something at the worksite that's focused on that? Bring in a van to do mobile mammography, something like that. So again, for companies that are just starting, great place to great resource and tool. And then your miscongeniality is the CDC health topics. When you go to this page, and I encourage that you do, actually this is one I also like because they list implementation strategies. There's links to those strategies and then their evaluation measures listed right next to them because it's important to both implement and evaluate. I will say it is very, very thorough. We have the user friendliness problems that you typically get with CDC resources, but that is your winner of the Welly, or the Miscongeniality Award for Welly, for implement and administer programming. And the last category that we have today is evaluate. This is something that most of us don't do all that well, but there is a tool that is designed to help you do that if you do wellness right. The winner is the Hero Best Practices Scorecard. Now, a lot of you may think that this should have been listed earlier when we talked about the Wellco Well Workplace Checklist, but as I interviewed Pat Roner, we talked about it. I read the information that she sent me. It became abundantly clear this could go either place, but it really was solid in this category. A little bit of background, not to go into too much depth, but it was beginning in the mid 2000s. Think tank was assembled, and at times this think tank included as many as 40 to 60 experts and professionals in the wellness industry. And they began to discuss one question, which is, what are the best practices in the wellness industry? Now, out of that discussion came the first Hero Scorecard. And there's a whole bunch of history, but to be brief, upon review, it is really plain to see when you look at the Hero questions that a rigorous scientific development process was followed. As a matter of fact, the scorecard has been scientifically validated by Ron Getzel and his group. It did go online in 2009, which is awesome. The scorecard is now on version 4.0. Updates that have been added include new best practices like resilience and things that represent shifting priorities in the industry. I will say also that upon completion of the scorecard, in case your organization has not yet used this, scores are immediately provided on 64 core items, and these scores are broken down in 6 sections. So you get your score, and it's compared to a national average. Main reason I put it here is because there really aren't that many resources provided to help plan interventions. So you get your score. It's a great way to track how you're doing, to track your progress, but not much in the way of intervention planning help. So it is a solid evaluation tool. the Hero Employee Health Management Best Practices Scorecard in collaboration with Mercer. They also win the award for having the longest name. Your runner-up, I really have to say there are no runners-up in this category. We did give a special achievement award to the University of Wisconsin and their free class on ROI and evaluation. This, I would not have known about this either, but again, thanks to Deb Laffler. That is the third time I mentioned her name. Thank you, Deb. This is what is called a massive open online course. It's being taught by David Chenoweth. I mentioned him earlier. And it is a wonderful opportunity for those of you really interested in evaluation, specifically on return on investment, to get in this course. It's offered for free through the University of Wisconsin, and learn about how all of this works. He's one of the brightest minds in this area. Unfortunately, that is not a repeating tool or resource, but it's online. It should be great. All right. The good news is we have had a lot of fun presenting all these wellies. I hope that as you go to this page, wellstep.com/wellies, you'll find a lot of help in doing wellness better, and you'll be able to get a lot of information perhaps that you did not have before, especially as you try to align your practice with some of the best practices and some of the research evidence out there. So that said, let's go ahead and go to question. I'd like to welcome Ryan Isaacson on the line, who's been filtering through your questions and has questions for us today. Ryan?
I am here, Troy. Sorry about that. Thank you so much for that presentation, Troy. We've got several really good questions here, so we will go straight to those. First off, would you mind showing the Wellies page? We had one or two who were having a little difficulty navigating that page. I don't know if you have access to do that right now. Perfect. Okay, so yeah, wellsteps.com/wellies. If you look here, so if somebody wanted to view something other than making a business case, they would simply click on the tabs below, and the appropriate links would show up for each category. So again, we had one or two that were asking about that, so perfect. So you'll be able to view all of those links there. And then Carol asked, I know you covered this in the beginning, but it might be worth it again. She wanted to know basically what was the criteria used, who voted for the Wellies. Again, so the criteria and who were the voters to determine the winners of the Wellies.
What I did was I polled several people, and I would say it was not very formal. There was not a standard committee. There was not a meeting, but I just polled lots and lots of people, and I kind of tabulated the responses people gave me. That's how the Welly winners were decided. That based on 30 years of experience in the industry and knowing about a lot of these tools and resources already. That's how the process was done. I think next year we can probably give out Wellies in a lot more categories, maybe in a different category, and we can include a committee. And Carol, we'd love to have you on the committee.
Perfect. Thank you, Troy. Okay, another question here is just basically outside of the Wellies, this new award, is there anywhere that somebody could go to compare all the different wellness tools that are out there?
You know what? That's one of the reasons why we were motivated to do this webinar, because we just didn't find one place. There was not a one-stop shop where you can go and find wellness tools. I mean, Wellcoa has a great website that explains their tool. Hero has a website that explains their tool. But maybe there is a great one-stop shop, but we just didn't find it. So we decided to recognize and put in the category some of these tools that we found really useful. And again, there's no real commercial advantage to us. I mean, the tools that are WellSteps tools, for example, that are included, they're all free. But we developed them to help people. Some of the other folks, our friends in the industry, like Wellcoa and Hero, have done the same thing. Those tools are free as well.
Perfect. Thank you. So maybe this Wellies Award will become that place where people can compare.
Well, I can't ever see Steve getting in an evening gown, but if that's what it takes.
Brad has a question about the WellSteps ROI calculator. He wanted to know if it would work outside of the United States, and he's specifically asking about in the UK. Is that something that could be used in other countries?
We have had many questions about that, and we have some friends up in Canada because even though there's national health care in just about every other country but the United States, there is always private insurance, and in many cases that's paid by companies. So our friends in Canada tried the ROI calculator, and they found that it in fact worked for them. But that this may be a discussion to handle offline. It sort of depends on the size of the company and whether or not there is private healthcare, if this would work or not. Um, yeah, so I think that's my answer for right now. It was really specifically designed for a U.S. population, given the U.S. health insurance system.
Right, okay, perfect. And then Allison just wanted to point out it appears that on older versions of Internet Explorer that the Wellies page might not be working as well, and maybe that's why people are having an issue navigating. It works better on a new version of Internet Explorer, Chrome, or Firefox, or several other browsers, but
We'll
that might.
take every chance we get to recommend that you use anything but Internet Explorer. And this is I'm being as nice as I possibly can. But being in this industry, I haven't seen. We've had a lot better luck with Chrome and with Firefox. Let's just put it that way. Was that nice, Ryan?
That was nice, yeah. Our IT guys might not have said it quite as nicely. Um, and so one of the main question that's comes up is people want to know kind of what is the future for wellness tools? Where are we going? Which tools are going to be the most important going forward? And maybe what new tools might be coming out?
Um, that's a fantastic question. I will go back to my previous point and say, in partial answer to that question, I see the biggest void in tools. I'm talking about tools that are free. Is a tool that will help a broker or a committee or a coordinator um, figure out what the pressure points or sweet spots are to get better leadership buy-in. Boy, we just see the participation and the outcomes that we see when there's an engaged leader. They're night and day. They're huge. And so, if there was a tool that would help us tap into, figure out how to get better leadership support, we would have already developed it. I see that as a massive opportunity. Maybe somebody smarter than me and Steve can figure out how to do that. I would love to see that happen. So in the future, I hope that happens. Um, in the future, I see that I'm not really sure that man, apps are everything these days. Everything's kind of going over on apps. I'm not so sure that this maybe I'm being Stone Age, but it feels to me like tools like this are still better done on the web. But I might be wrong. Maybe there's some folks out there developing really slick apps to help do this. But there's just a lot more, just because of the screen real estate. There's just so much information to be consumed, and it's a little bit hard to do on a smaller device with a smaller screen. I had a couple of other thoughts, but maybe I'll just stop right there for the moment.
Okay.
Just one last thing, Ryan. Thank you for your patience. The I will say the same thing about committees and coordinators that I said about senior leaders, only not to the greatest extent. If we could figure out tools that will really help coordinators and committees kind of dial in, get a clear understanding of what their job is, and help them see that because most coordinators and committees have other full-time jobs. They work 40 hours a week. And this wellness responsibility, in many cases, especially with small and mid-sized company, has just been stacked on to the duties that they have. And so you can kill enthusiasm with coordinators and committees by not giving them anything to do or by giving them too much to do. The tool should help them see that it's not too hard. They can do it with just a little bit of time every day, and that they should also be able to see how their energy and their investment of time will help make a difference in the success of the wellness program. That sort of tool, it's squishy, it's wiggly, and I have not seen a great tool out there that really does that. It's what we're trying to do with that Well Steps coordinators page, but maybe we haven't scored a touchdown yet.
Okay, thank you. Perfect. Going back to what you just said about apps, we had a question from Kira. First, she was, very um, expressing her gratitude for the webinar today and the new tips and tools that she's learned about. She wanted to know what other health apps do you see that are out there that are helpful for worksite wellness? I know you kind of mentioned maybe going away from that, but she wanted to know about that.
Well, in terms of engaging individual users, apps are sort of all that. In terms of helping to make a business case or helping to bring senior leaders on board, I don't know that I don't know we're to a place where an app can do that just because of the screen real estate. So, man, there are so many apps out there. I think I didn't dig too much deeper into the app world and that, but MyFitnessPal probably has not a corner on the market, but it's probably the best thing going out there right now. WellSteps is developing an app for WellSteps customers, but MyFitnessPal is individually oriented. So here's the trick: if you use an app. So I'm not answering your question. I'm sorry, but I think MyFitnessPal is probably the best one available right now, based on everything I've seen. The trick is that an app it promotes a head down, walking down the sidewalk, running into people using your app and your smartphone device mentality. You guys all know what I'm talking about. With a worksite wellness program, you have to foster a group-oriented program. So the next best app is going to engage groups of people. And that's why I love the social media possibilities on MyFitnessPal. It's going to need to take the individual orientation of an app, and it's going to need to bridge the gap so that there's sort of a social, I'm not talking about social media, I'm talking about real social participation and engagement. In other words, lifting your eyes up and talking to other people. When we can do that with an app, we've scored. So that app that I just described, I don't think exists yet.
Mm-hmm. All right. Well, the final question is, when will the winners be receiving their trophies?
There aren't any trophies this year. There's a really fancy, there's a recognition for winning a Welly. And we just say that we love you. We're grateful that you're doing stuff that's good and that's free. And the trophy is metaphorically in the mail. Let's just say it that way. So if there are no more questions, I want to thank everybody again for being on this webinar today. For some time, we've had this next webinar slide up. This will be fantastic. You're in for a real treat. How to maximize wellness program participation. This will be presented by my business partner, Dr. Stephen Aldana, who does a great job on these webinars and who unwittingly will be singing and wearing a party gown in our next webinar. He doesn't know it yet. But he does an amazing job in these webinars. We hope that you all register for it. The registration link is already up on the WellSteps website. Click on the webinars tab on the lower right-hand corner. We hope that you can join us on Thursday, October 30th, and we wish you well. Have a fantastic weekend, everybody.